That way, because the sensor is all black, right? It's hard to tell in that patient's mouth because it's so dark in there. Where the edge of that sensor is, that little line will show you where that is. Okay. So the other thing is, I want to orient you to this snap array just a little bit as far as your patient's concerned. So remember that whenever you are working on your patient and you're asking your patient to bite down on the snap array, if you are working on the patient's right side, that larger side will fall to the side that you're working on. It'll fall to the patient's right side. If you are working on the patient's left side, it will fall to the patient's left side. But we're working on the right, so we're just going to go ahead and flip it back over. The other thing is, if you get that wrong, that there's nothing on that side to indicate where the edge of your sensor is. So that's another indicator. There is no mark on that side to indicate where your sensor is. It's only on this side. Okay, so that should fall to the buccal side. Okay, I'm going to take this. I'm going to clamp it right there at the very bottom. I'm going to go ahead and cinch that up fairly tight, and I'm going to place this in the patient's mouth. And I like to kind of go in at an angle. I ask that patient to open fairly wide. I'm taking the premolar picture. So where should the edge of my sensor be? At the canine. So identify your canine first, and you could use that mark to put it right on the mesial of that canine. You don't have to bite down hard, just to where it stays in place. And that should be on the occlusal surface of the teeth that you're trying to take. Can you all see that?
Yeah.
So there is the canine. That mark is right there on the mesial. You're getting this whole area right there. Okay. Are we okay so far?
Yeah.
Okay. That sensor is not straight. Vertically, that sensor turned kind of like somewhere around there, but I'm not going to tell you how it turned. I want you guys to do your very best. You could even take your flashlights, not that you can do this in a dental office, but just so that you can kind of go and look and see what you think the vertical angle turned. And I'm going to all have you come to a consensus on what the vertical is. You guys are all going to work on this. What is your vertical? So take a look at it. Find out how much it turned, and then we'll all do the vertical together.
You got this. You all got this. He's like, no.
Wait, can I go in? Yeah.
Can I flip this on somebody? Who's going to take it? You want to take it? You want to take it?
You stepped away. Wow. I guess you're gonna pick somebody.
Well, it's only gonna, well, you don't have to chat. I'm just saying that.
Just for our discussion.
Yeah, for your discussion group.
That's fine.
Okay.
Okay. You said we have to find the vertical? Yeah. Like how much it moved.
You also want it to be in the actual mesial on the second vertebral, right? The molar PA.
Or the one near the mesial, and you want to get the entire, like
The entirety.
I say the end line where it's supposed to be here, the back of it.
I think we're talking about the vertical, so
Oh.
angle,
My bad.
but the angle of the sensor inside is usually it's like this, and we do like our eye wings, but it's moved this way now. So
the first few
How do we
weeks.
do it?
so now it's moved. So it's moved
I'm
from
going
this to
very
this.
slow. And then once they
Like 15?
Grasp it.
once they grasp it,
I'd say like 10, 15.
the curve
10,
changes, they go,
15.
all right, you know. But if I pushed it, you would be struggling a little bit through it there.
Degrees?
It's kind of like.
No, it's good. It's a good.
It's like 15 degrees into it.
We think it's like 10 or 15 degrees.
10 or 15 degrees?
Yeah.
Okay, go ahead and set it to wherever you think. Now, are you going straight to the bisector? Do you think the bisector is at 10 degrees? I mean, if you said 10 degrees, so is that right to the bisector? Because remember on the other one I said add 5 degrees to it.
Yeah.
So you're saying that the bisector is at 10 degrees.
So we need to
Okay.
add 5.
And so if you added 5 to that,
It would be 15.
it would be 15 degrees.
Yeah. So he wants you to set the head thing?
So do me a favor, go ahead and set it to if you thought that the bisector was at 10 degrees, take it to 15 positive degrees, and then take me through the rest of it. Go ahead and do your horizontal angle.
Okay, so this would be angled here. Anybody want to help?
Cover the sensors.
Okay. And putting the edge of the PID to the line.
And I'll
Does
tell you
this line
something
even
else
count at
you'll-
all for
you'll
the
see right
upper
now a little bit,
and
doesn't
the
make things a little bit easier. So,
Would
you
doing
want
this whole
to
like
do your
straight
three,
thing for the premolars even work?
Sometimes it can work.
Oh, a bite, you mean?
Like the bite? Yeah. Would this even work at all?
Some cases,
Would the
It probably
upper
has
part
to,
or-
so you don't have to get a coconut. It has to be perfect.
It's okay.
So it should work the same as the bite. Okay. Where is it?
Like this. Do you think it should go like this way?
Maybe a little bit.
You're not saying anything because I'm still in you.
Yeah.
Oh, no.
Maybe,
Okay.
yeah.
No, I typically come in here and then what I do, I have a 1 hour gap in between
Is
my
that
shift
15?
and the class, so I can just stay
Okay.
longer. So right now I've been here about what 30 minutes now.
Alright, we think it's ready.
Okay.
Yeah, then you finish, that's why I come in earlier, so I can make the time.
Sorry.
Okay. So vertical, horizontal, cover the film. Did you all see it? Did you like it? Would you change anything? So I'll step back just a little bit because I want you all to review it, because,
Get in there.
It's kind of like,
yeah, hop on in.
no, I don't want to be in the video. But I feel like it's too straight on. Like we're gonna take a bite wing instead of taking like the apical
Correct.
shot.
Okay. Now, and to be fair, I didn't go over with this portion of it as far as covering the sensor. So, but you are right. Remember that we are not taking a bite wing, so you have to orient this a little bit better.
I think it just needs to go a
Nice
little more
job.
higher.
You did good. Okay. So here's what I would say, just because I didn't go over it with you guys. The sensor, you all know where the sensor is at the bottom. The sensor is right at the bottom edge of this. So as long as the bottom of this cone or the PID is slightly below that angle or that edge, we are okay. You're covering the whole thing. So the bottom of this is hitting way down here still. So this whole thing needs to go higher and higher and higher until it's probably right around that lip. If you go too high, you're gonna get a cone cut. Yeah, Valerie, it looked like you were gonna say something.
Oh no, I want to take a picture.
Go ahead, go ahead.
He doesn't want to get in there.
So we have it right here. Okay, now this part doesn't change, but when you guys were doing bite wings and we were doing a premolar picture, as far as covering it goes, where was the side of your cone when it came to covering the sensor or the film on a bite wing radiograph
For a premolar?
for premolar?
Just where your inner line meets up with the lateral also.
The lateral, yeah. So this would be going to lateral. If I'm doing this, we are passing that lateral and going right onto your anteriors. We're even passing the anteriors. So I'm not going to change your horizontal because you guys worked hard on this. So I'm going to just take this and then bring it back to your lateral, which is right there. Okay, bring it back to the lateral. So I'm going to take this picture. I'm not just so you guys can take a look at it and see how it turned out based off of the information that you guys had. So let me go ahead and do this. And now this is on the patient's upper right side, right?
Yeah.
And so I'm just gonna highlight 4 and 5. I'm not highlighting the canine because, you know, it's gonna be included in there anyway. So I'm gonna press that. Is it showing on there? Oh, good. Okay.
Not bad.
Good.
Not bad. Not bad. Okay. But I'm gonna sort of highlight this a little bit more just so you can sort of see this. This is the apex. It's right there.
Yeah.
It's right here for that one. Now we still need about 3 to 5 millimeters above that to where we could properly diagnose and say there's no abscess going on or any kind of anomaly there. So so to add a little bit more, so I'm thinking that I need my glasses, and I just want to sort of take a look at your. I would have done exactly what you did. Okay, now that was 5 extra degrees that you put on there. So anywhere between, especially in the posteriors, and I want you guys to know this, when it comes to canines and when it comes to premolars, they are typically a little bit longer. And so you might have to even add 5 to 7 millimeters, go a little bit extra, and you guys should be okay, you know, when it comes to that.
10, right? And then add 5.
That makes sense? Okay, just so you know how this thing is quirky, it's not you guys, it's this, and we have to adjust to how digital imaging kind of reacts a little bit, okay?
Can you do the proper one so we can see, like,
Take
yeah.
how it, well, based off of what we just saw right now, so here's how I gauge it. I'm gonna be like, okay, I need about a 10 more degrees, in my opinion, to make this proper, to make this just have enough room to where we can see above the apex. So I'm gonna take this and then add, so it's at 20, I need to be at 30. That's how I would have done it. But it was only because I got to see it. You know, you already showed me the product, you know, I know what we have left. So now because I pushed it down, I've got to take this and bring it on up. By the way, while I'm doing this, I just wanted to say you guys did a fantastic job when it came to your horizontal angle. I'm going to talk to you about that just for a little bit. So I'm going to repeat that just so you can see what that looks like. And then you'll be able to compare the difference on there. Okay, so there's 2 of them, so I'm going to take this one and bring it over here. Here's your guys's right there. So look at the difference on here. I know it's kind of small on there, but is it able to see it?
Yeah.
Okay, so your apex is right almost at the very tippity top right there. My apex is a little bit further down, and I'm showing about a good 3 to 5 millimeters on there. So troubleshooting is what you guys really need to be sharp on, is troubleshooting. And I'm going to talk about this a little bit too. But look at ideally yours would be better if it had that apex on there, because I'm showing the entire tooth. Now look what happened to the occlusal surface on mine. I'm starting to lose it. I almost cut it off. Actually, I cut just a little piece of it off. Ideally, you want the whole film to represent this area with on its own merits, you know. But sometimes we don't get that. And the great thing about the FMX is if you cut this thing off, I get to see it right here again. So there are some things that I could allow for you guys to miss when it comes to that.
So if we would have kept the 20 and just pushed it up a little bit, would it like been better?
Great question. Did you guys hear what she said?
Yeah.
If you guys, if I didn't change it, and I just left the 20, the exact degrees that you guys all had, and you just did this, and you just brought it up. Am I correct?
Yeah.
Okay. Would that be okay? What do you think?
You get a cone cut.
You'd get a cone cut. So bringing it higher physically doesn't change, like I'm gonna get more apex. It's your vertical angle that makes that happen. That's a great question because I miss that sometimes when you guys are doing your instruction. I'm like, oh, I forgot to tell them that. Because it seems reasonable. You bring it up higher, you get more apex, but it's not that. It is simply your vertical angle is responsible for that. Okay, I want to give you a little tip, and here's the tip. When you guys are doing your all three things, vertical, horizontal, covering the film, I kind of recommend that you do your horizontal first. Yeah, I don't know if you guys saw this when you were doing it, but it seemed a little bit odd maybe when it was at a vertical, when you had some vertical angle to it, and then you were trying to figure out your horizontal, it was like, ooh, that's kind of weird. I recommend doing your horizontal first, making sure that that is horizontal to the teeth that you're trying to take, and then throw your vertical on there. You know, just a little advice. If it doesn't bother you, then you can do any order that you want. You just have to make sure you do all three. Okay. Okay, one last thing, and then I'm gonna let you guys start taking x-rays. And I'm gonna do this fairly quick. Because I don't need to dwell on this just a little bit. I just want to make sure that you guys know. When you guys are doing digital, you really do have to think critically on this. And the only reason I say that is because you can avoid, you're seeing these x-rays come up right away. You see what's happened and how that's going to affect, how that could possibly affect your next film. Okay. There is an order that this system wants you to do. And whenever you are doing your full mouth, it always wants you to do typically the canine first, because it's in the anterior part of the mouth. You're not going to spark that gag reflex, you know, by trying to do a molar. So it wants you to begin in the anteriors. So that's what it has you do right there. So I'm gonna make some mistakes on purpose right off the bat. Okay. Horizontally, I'm going right through there. There's my canine. I'm going to go right here this direction. Horizontally, I think I'm okay. But I'm intentionally going to go ahead and do my vertical wrong. I'm going to put less than where I should be at. And then I'm going to cover the sensor and put it right here. Okay. And I'm going to go ahead and take it. What do you think it's going to look like now that I've given less positive vertical angle than I should? What do you say?
It'll look short.
You're going to say it's short?
The apex is cut off.
Apex is cut off. Apex is cut off. Why is it cut off? I covered the whole thing with the sensor.
It's straight on instead of being it's like shadows.
It's like shadows, so
There's no shadow.
I am looking for something. You guys are close, you're on it. I just,
The beam's not gonna go like down.
okay. I'm gonna press and hold. you're right, by the way. Now, remember that it doesn't throw the nice, perfect film like it should be. It just kind of, oh, actually, it actually did.
You're just too good at this.
But
You got it right?
Look, no. Look what happened. It's exactly what some of them thought it was going to be. First of all, I have a lot hanging out over here. I cut off the apex. Does that look short? The tooth, does it look short? Does it look normal, you think? Does it look stretched out? It looks stretched out. So remember we did this over there with the shadows. So that's what when you said shadows, that you would have said that one word. It was elongated. And generally, if you elongate that thing, you're going to lose the apex, because if you're stretching this tooth out so much that you're going to lose that apex. But let's just say that this was your patient, and that was the very first film you took, and you're like, oh, I missed the apex. Before you take the next one, because the very next one that's going to have you take is the central anteriors. It is the central anteriors. Before you make that same mistake, you have to think about what you just did and then troubleshoot it before you take that next one. So what are you guys going to do? Yeah, you're going to add more positive vertical angulation. The question is how much? Now, if I saw that if I needed 3 to 5 if I added 10 millimeters on the film that you guys took, because I barely had any room and I wanted some room, and this one I clearly cut that apex off, how much do you think you would add?
You have plenty of room at the bottom, so you could probably do like 15.
Okay, so 15 I think would just get me to where I would just barely see that tip.
So that's
20,
20.
25.
I want you all to come to a consensus on this one, but you're doing the right thing. You're moving this thing on up.
30.
Y'all say 30, or is that too much?
Well, earlier we did 30, right? On the other ones.
Okay, let's go between 27. I'll do 28 and a half. So it is on 15, 20, 25. So that's 15 degrees right there. So about 5 more degrees, and I just ran out of scale. There's nothing on there, so I have to go off the backside.
Where are you now?
I'm on 30. I'm on 30 degrees right now. 35 actually. Okay. So I added like 20 degrees, 25, 20 degrees I added, right? Okay, I'm gonna take this, I'm gonna bring it all the way to where the rim, bottom of the thing is hitting the rim. We're gonna repeat this. And I'm only doing this so you guys can sort of see how this thing reacts before you start taking them. Something to think about. Not bad. Now, ideally, that canine should be right down the center, but sometimes you don't always get exactly what you want. But remember, as long as I can see the interproximal space and I'm representing the whole tooth, we're in pretty good shape. Crown, root, apex, surrounding bone structure, and we are in good shape.
So that was 35?
That was 35 degrees, and it'll change. It'll change for every single patient you guys have in that chair. You cannot go by, okay, that canine is always at 30 degrees. Some patients have a flatter bite, others have a steeper bite, and that'll change. Go to your bisector, and then with canines, I would probably add, close to 10 degrees additional. 10 degrees additional when it comes to an anterior. So this will be all on your thing, so you can mark your notes down, like recommendations, just like little cliff notes, that you guys can take really, really quick on some of those things. Okay, but this prevented you from taking another one on your anteriors. And I've seen students to where they did that, they messed up on the first one, they didn't troubleshoot it before they got to the next one, and they made the same mistake twice, and it almost eliminated their patient, you know. In some cases it did. They were like, we went overboard. Now we have to dismiss our patient and find a whole new patient. And I'm trying to prevent that for you guys. So.